Hello class, welcome to Emergency Medical Responder, Chapter 20, Vehicle Extrication and Special Rescue. In this chapter, we will be covering EMS operations, that is, the knowledge of operational roles and responsibilities to ensure patient, public, and personnel safety. In specific, we will be discussing vehicle extrication, safe vehicle extrication, which is covered on pages 412 through 421 of your chapter, and use of simple hand tools, which is covered on pages 416 through 419 in your text. The extrication process consists of 7 steps. Special rescue situations can be life-threatening to both the rescuer and the patient. And the types of special rescue situations include water rescue, diving problems, ice rescue, confined space rescue, farm emergencies, and bus collisions. In each situation, your first objective is to always maintain your personal safety as well as the safety of your crew. You will need several hours of practical exercises to become skilled in the process of extrication. You should be familiar with extrication equipment, its use, and hazards involved in the extrication process. Ideally, rescuers should wear protective equipment similar to a firefighter's gear, including a coat, pants, boots, a helmet with face shield, and gloves. Specifically leather gloves and even leather gardening gloves will work. Minimally, a helmet with a face shield or goggles and gloves should be worn. To ensure best care for the patient, many different agencies may need to cooperate. Keep in mind the following basic guidelines. First, know the limitations of your training, equipment, and skill. Identify any hazards such as gasoline, power lines, or wires, and hazardous materials. Control those hazards for which you are trained and equipped. Make sure you're able to safely gain access to patients, provide patient care and stabilization, and remember to move patients only if absolutely necessary. As an EMR, you have the following 2 primary extrication goals. First, to obtain safe access to the patient, and secondly, to ensure patient stabilization. Step 1 is to conduct a scene size-up. As soon as the dispatcher assigns you to an incident, begin to anticipate and plan for what you are likely to find upon arrival. Use your knowledge, but be flexible in planning. If your dispatch information is complete, you will know A, which type of vehicle or vehicles are involved, and whether there are injured or trapped people, burning vehicles, or hazardous materials present. As you approach the scene and before you exit your vehicle, get an overview of the entire incident. Rapidly determine the extent of the accident or incident. Try to estimate the number of patients. Try to locate any hazards that may be present, and be sure to call for whatever assistance you may need to manage a particular incident. Step 2 is stabilization of the scene and any hazards. Keep a sharp lookout for hazards that can result in injury, disability, or death. Keep in particular mind the presence of infectious diseases. Many patients involved in motor vehicle crashes will have soft tissue injuries and active bleeding from open wounds. Follow standard precautions at all motor vehicle crash scenes. If sharp glass or metal is present, wear heavy-duty leather gloves over latex or vinyl gloves. If there is the danger of splattering blood, consider using face protection. You also need to consider traffic hazards. Park your vehicle and other emergency vehicles so that they protect the scene and warn oncoming traffic to avoid the crash site. Consider the design of your vehicle's warning lights and park so that you can use them to their best advantage. Wear an approved safety vest and other personal protective equipment. Ignite fusees or warning flares as soon as possible, and survey the scene for other hazards. Also be aware of bystanders. Keep bystanders away from crash scene by giving them specific directions. Use a rope or police or fire barrier tape to establish an off-limits area. In terms of spilled fuel, expect to find a fuel spill if a motor vehicle has been hit near the rear, on its side, or if it is upside down. If a fuel spill is present, call the fire department. If patients are in a motor vehicle with a fuel spill and the fire department has not yet arrived, consider covering the fuel with dirt. In terms of motor vehicle batteries, reduce the possibility of an electrical short circuit by turning off the vehicle's ignition. Do not attempt to disconnect the battery unless you have been trained in the proper way to do so and have the necessary tools. Hybrid vehicles and electric vehicles have multiple high voltage batteries. Downed electrical wires may be caused by high winds, ice buildup, or a vehicle hitting a utility pole. Locate wires but avoid contact with them. If a vehicle has a downed wire across it and passengers are trapped inside, immediately instruct passengers to stay inside the car. Keep all bystanders away from the vehicle. Call a utility company for assistance and also call the fire department for assistance. Be sure to check everywhere, including under vehicles, for electrical hazards. Assume that every vehicle involved in a crash is unstable unless you have manually stabilized it. If a vehicle is on its wheels, ensure stability by chocking the front or back of each wheel with hubcaps or pieces of wood. If you can gain access to the inside of the vehicle, place the transmission in park and set the parking brake to prevent the vehicle from moving. You can deflate tires by safely cutting or pulling the valve stems. If a vehicle is on its side or upside down, be sure to stabilize a vehicle on its side, and that is beyond the range of skills and equipment for many EMRs. If you must enter a vehicle to respond to a life-threatening situation, do not climb on the vehicle. Carefully break the rear window glass and enter through the back of the vehicle. Bend over or crouch down to stay close to the ground. An upside-down vehicle is relatively stable, and the primary hazard here, however, is spilled gasoline. In terms of vehicle fires, impact fires occur when the gas tank ruptures during a crash. The vehicle is usually rapidly engulfed in flames, and it soon becomes impossible to approach it for a rescue attempt. Passengers are usually rescued by bystanders and witnesses to the crash. Post-impact fires are often caused by an electrical short circuit and can be prevented by turning off the ignition. Should a fire occur, first turn off the ignition, extinguish a fire with a portable fire extinguisher, and remove passengers from the vehicle as soon as possible. Emergency actions for motor vehicle fires include using a dry chemical fire extinguisher. Immediately have someone else gather fire extinguishers from other vehicles at a scene. Use an extinguisher to keep flames out of the passenger compartment. Do not be overly worried about discharging an extinguisher onto passengers because dry chemical powder in a fire extinguisher is non-toxic. Remove the patients as quickly as possible, but take care because they may have sustained injuries. Move everyone at least 50 feet away from any vehicle that is on fire, and stay away from the front and rear ends of a burning vehicle. Step 3 is to gain access to patients. Access through the doors. Between 85 and 90% of all patients found in motor vehicles can be reached simply by stabilizing the vehicle and then opening a door or rolling down a window. Try all doors first, even if they appear to be badly damaged. Make sure that the locking mechanism is released. Try outside and inside handles at the same time. Try to gain access through windows. Do not try to break and enter through a windshield because it is made of plastic laminated or safety glass. Side and rear windows are made of tempered glass and will break easily into small pieces when hit with a sharp pointed object. Since 2018, about 1/3 of vehicles have safety glass on side windows also. Two types of glass in vehicles are plastic laminated or safety glass, which you see on the left, and tempered glass, which you see on the right. Carry a spring-loaded center punch as part of your EMR life support kit, and you see an example of that in the picture here. If you must break a window to open a door or gain access, try to break one that is farthest from the patient. Advise ambulance personnel if a passenger is covered with broken glass. After breaking a window, use your gloved hands to pull remaining glass out of the window frame. Try to unlock the door again. To access a vehicle through a window, follow the steps in Skill Drill 20-1. When you gain access to a crashed vehicle, be alert for undeployed airbags. If you cannot gain access to a vehicle, do what you can to assist patients. Stabilize the vehicle and protect the scene until proper equipment arrives. Step 4 includes providing initial emergency care. Conduct a patient assessment on every patient. Monitor the ABCs, control bleeding, treat the patient for shock, stabilize the cervical spine, provide emotional support, and maintain a patient's body temperature with a blanket. Be sure to leave patients in the vehicle unless it is either on fire or they are otherwise in immediate danger. Skill Drill 20-2 shows how to perform initial airway management when a patient is in a vehicle. Step 5 involves patient disentanglement. This process usually requires tools and specialized equipment. In some serious extrication situations, disentanglement can take up to 30 minutes and requires advanced training. Modern rescue crews use the concept of the golden hour or golden period when managing serious trauma situations. The less time spent at a scene with a seriously injured patient, the better. The patient's chance for survival increases if rescuers can get the patient to definitive medical care as soon as possible. Step 6, which is preparation for patient removal. As disentanglement proceeds, dressings, bandages, and splints are applied, and the patient's head and spine are stabilized. Access the route used to care for the patient may not be adequate as an extrication route. Extrication routes must be large enough to permit safe removal of a packaged patient. Step 7 is patient removal. Once a patient is packaged, he or she is removed from the vehicle and placed onto a stretcher of a transporting ambulance. Although you are directly involved in only the first 4 of 7 extrication steps, you should be aware of the entire operation and be prepared to provide assistance if called upon to do so. Let's go through a review of the extrication process. Call for additional resources and extrication help. Specify the number and types of vehicles involved, and do not stand idly by while waiting for help. Identify and contain hazards. Park your vehicle so that its headlights and warning lights can be used to protect and also to light the scene. Clear a working area around the site of the crash before you or rescue personnel attempt to stabilize the vehicle or vehicles. Use your head. Think and use what tools you already have on board that can provide assistance. Try opening doors first rather than breaking windows. Once you gain access to patients, assess and monitor their conditions, but above all, remain calm. Let's move on to water and ice rescue. In terms of water rescue, you need to realize that the person in water may be fatigued, they may have sustained a diving injury, or may have fallen through ice in winter. Jumping into the water to save someone can endanger your own life. In a water rescue situation, remember these steps. First of all, reach. Use any readily available object. If a person is close to shore, a branch, pole, or a paddle may be long enough. Also, in terms of rescue, you need to be able to throw. At a swimming pool, dock, or a supervised beach, a flotation device may be available. If a life buoy is available, throw it to the person in distress. As a last resort, you may have to go into the water to save the person. Into the water only if you are a capable swimmer trained in life-saving techniques. Remove encumbering clothing before entering the water, and take a flotation device with you if one is available. This slide is a summation of everything we just went through. First, reach. Second, throw a flotation device. Third, row to the person that needs rescue. And fourth, if you have to, go. We're going to talk now about the initial treatment of a person in water. In a water rescue situation, your primary concerns are threefold. Open the airway, establish breathing and circulation, and stabilize spinal cord injuries. Skill drill 20-3 describes how to turn patients who are face down in a water face up. Use a jaw thrust maneuver to open the patient's airway if a neck injury is suspected. Do not hyperextend the neck. Look, listen, and feel for signs of breathing. If the patient is not breathing, start rescue breathing while the patient is still in water. If a patient has experienced cardiac arrest, quickly stabilize the head and neck. Remove the patient from water, place the patient on a hard surface, and begin CPR. Treat any patient who is unconscious in water as if he or she has a spinal cord injury. Also assume presence of a spinal cord injury if a conscious patient is in water. If the patient reports numbness or tingling in the arms or legs, you need to suspect a spinal cord injury. Also, if they report that they are unable to move extremities or report neck pain, if any of these are present, you need to assume the presence of a spinal cord injury. Strap the patient to a backboard, stabilize the head and neck, and remove the patient from water. It's important to note that backboards are specifically designed to float and are able to be manipulated easily in water. We're going to move now to diving injuries. Most recreational divers use a self-contained underwater breathing apparatus, also known as a scuba. Scuba gear consists of an air tank, a regulator, a mouthpiece, and a face mask. Most underwater diving accidents occur in coastal regions or in areas with large lakes. Specialized injuries associated with diving include air embolism and decompression sickness, or the bends. Both are caused by air bubbles being released in the body as a result of pressure changes while diving. If an air bubble affects the brain or spinal cord, the signs and symptoms may be similar to those of a stroke. The victim may have dizziness, difficulty speaking, difficulty seeing, and a decreased level of consciousness. If an air bubble causes a collapsed lung, signs and symptoms will include chest pain, shortness of breath, and a pink or bloody froth coming from the mouth or nose. If an air bubble obstructs blood flow to the abdomen, the patient will experience severe abdominal pain and may be bent over. If an air bubble involves a joint, there will be severe pain in that joint. For treatment with diving injuries, maintain the patient's airway, breathing, circulation, and normal body temperature. Administer oxygen as soon as it is available. Some physicians recommend placing the patient on his or her left side with the head of the patient slightly lowered. Patients with diving injuries may need to be transported to a hospital that is equipped with a hyperbaric chamber. We're going to move now to ice rescue. Ice rescue is extremely hazardous because no ice is truly safe. Do not exceed the limits of your training and do not put yourself at undue risk. Visually mark the location where the person was last seen so other rescuers can concentrate their efforts in a limited area. The basic rules of ice rescue are the same as those for water rescue in terms of reach, throw, row, and then go. Reach for the victim using anything that will extend your natural reach. Throw a flotation device, throw rope, or anything that floats to pull in a victim. Row or propel a small boat to a victim, or use a toboggan to get across ice. If you must go, secure yourself to shore with a rope around your waist, lie on your stomach, and proceed across the ice. Spreading your weight over a wider area reduces your chance of falling through the ice. Maintain good communication with other rescuers. A motor vehicle on ice presents a risky situation. Instruct the vehicle's occupants to avoid unnecessary movement. If a vehicle has not gone through the ice, instruct the occupants to open the vehicle's doors. If the doors cannot be opened, instruct the occupants to roll down the windows so they have a better escape route. During ice rescues, both persons on ice or in water and rescuers are all at risk for hypothermia. Keep all rescuers as warm as possible. Rescued persons should be stripped of wet clothing, dried, and warmed as soon as possible after they are removed from the water. If the patient has no pulse, start CPR and continue until the patient has been transported to a hospital and warmed properly and safely. We're going to move now to confined space rescue. Confined spaces are structures designed to keep something in or out. Confined spaces may be below ground, ground level, or in elevated structures. Below ground confined spaces include manholes, below ground utility vaults or storage tanks, old mines, cisterns, or wells. Ground level confined spaces include industrial tanks or farm storage silos. Elevated confined spaces include water towers and storage tanks. Rescue situations involving confined spaces have two deadly hazards. First is respiratory hazard. Confined spaces may have insufficient oxygen to support life, or there may be a poisonous gas that may be present. Rescuers must never enter a confined space without proper respiratory protection. There are also collapse hazards. In a mine, rescuers may need to shore up confined spaces before they can safely enter. In any confined space situation, call for additional assistance and do not enter the space until help arrives. These are some illustrations of confined spaces, and just bear in mind always that confined spaces may have insufficient oxygen to support life without the use of a self-contained breathing apparatus, or an SCBA. Now let's talk about farm rescue. Farm accidents pose a wide variety of challenges for rescuers. Reporting of an emergency may be delayed if a farmer works alone. There may be a lengthy response in getting to a farm. It may be hard to pinpoint the exact location of the emergency. Poor roads, non-existent roads, and muddy soil may require you to leave your vehicle some distance from the patient. As mentioned, farms contain a wide variety of hazards. Animals can seriously injure farmers and pose a serious risk to rescuers. Farms also contain a wide range of hazardous chemicals such as pesticides, herbicides, and fertilizers. Farms use many types of electrically powered machinery as well. Be alert for shock hazard posed by the presence of electrical lines and electrical devices on any part of a farm. Some accidents involve tall barns and silos. These accidents often require rescuers trained in high-angle rescue techniques. Silos should always be treated as hazardous confined spaces. Some farms include below-grade manure storage pits, which are filled with poisonous gases or are deficient in oxygen. Accidents with farm machinery usually involve rollovers of farm tractors, entrapment in machinery, and severing of body tissues by sharp objects. Your role as an EMR in farm rescues include stabilizing the scene and providing initial medical care for the patient. Follow the 7 steps of extrication. Perform a careful scene size up to determine the scope of the problem. Shut off any electrical power and turn off any machinery that is still running, if possible. Call for adequate assistance from fire, rescue, and EMS organizations. Stabilize any hazards that you can while keeping yourself and the patient safe. If possible, gain access to the patient. Provide initial emergency care to the patient. Establish responsiveness. Support the patient's ABCs. Control bleeding. Maintain the patient's body temperature, and provide emotional support. As other rescuers arrive on the scene, help them to disentangle the patient and prepare the patient for removal, and then remove the patient safely. We're going to move on now to bus rescue. Because of the large number of people being transported by buses, bus crashes occur in virtually any community. Crashes involving buses are considered multiple casualty events. Your role in a bus rescue means that you perform a scene size up, call for adequate police, fire, and EMS resources, and establish an incident command system if multiple casualties are present. Set up a one-way traffic pattern for responding vehicles to avoid congestion and gridlock at an emergency scene. With a large number of patients, triage patients using the START triage system. Now let's summarize everything that we covered in this chapter. You should be able to perform the first 4 steps in the extrication process and assist other rescuers with steps 5 through 7. In terms of ice rescue, water rescue, and underwater diving accidents, confined space rescue, farm rescue, and bus crashes, these are all situations that require extensive skills and special training. It is important to help patients, but not at the expense of your own safety. In water and ice rescue situations, you can take some simple steps to help the person without endangering yourself, including reaching out to the person with an object, throwing a flotation device to a person, or rowing to a person in a boat. You may not be able to distinguish between 2 major medical emergencies created by underwater diving accidents, such as air embolism and decompression sickness, but you can provide basic care and summon appropriate assistance. We also talked about confined space rescue. In confined space rescue, your primary goals are to call for additional assistance and to prevent other people, including yourself, from becoming victims. Farm emergencies and bus crashes are complex rescue situations. However, If you follow simple steps, you can often stabilize these situations and provide initial aid to patients. Now let's go through some review questions. Review question 1. Which of the following would not be considered a special rescue situation? A. A school bus collision. B. A hiker who has fallen through thin ice. C. A diver who is discovered unconscious on the surface. Or D. An elderly man with chest pain at the park. This should be pretty obvious, but let's see if you got the right answer. It is, of course, D. An elderly man with chest pain at the park. That would be considered a conventional rescue rather than a highly specialized rescue. Review question 2. As an EMR, your primary goal in extrication is to A. Use specialized equipment to access patients. B. Access patients safely and stabilize them. C. Reach patients as quickly as possible to administer pain medications. Or D. Dismantle vehicle or machinery. The answer is, of course, B. Access patients safely and stabilize them. Question 3. Once you have access to a patient, you should A. Perform an assessment. B. Rapidly extricate the patient. C. Administer oxygen. Or D. Immediately begin treating injuries you see. The correct answer is A. Perform an assessment. Class, thank you as always for your attention. And this is a bit of a complex chapter. Just make sure to always perform within the guidelines of your training. Never step outside of your level of training and call for the appropriate assistance that you need. Again, thank you for your attention, and we will meet again for Chapter 21.